The number one cause of death in the US is heart disease. In both men and women, heart disease kills more people than cancers and respiratory illnesses and other reasons combined. And we now know that about 1 in 4 women die of heart disease, similarly for men. And the highest risk lies with African American, and especially African American women. There are certain risk factors that are modifiable and certain risk factors that are not under your control. The ones not under your control that I wouldn't worry much about are getting older, so older than 55, and family history of heart disease. But the ones that are under your control are smoking. Smoking is the number one cause of preventable death in the US. High blood pressure, diabetes, being overweight or obese, lack of exercise, eating a poor diet, and stress and depression, particularly in women, are risk factors. Keep in mind that 2/3 of people who have their first heart attack didn't know that they were going to have a heart attack. So it's extremely important to control your risk factors and be checked out before you have your heart attack. So what are the common symptoms? I would say looking at the risk factors. If you're diabetic, high blood pressure, obese, lack exercise, you can control all of those factors. But during a heart attack, we know that the commonest symptom in both men and women is chest pain. Women can also have some unusual symptoms like shortness of breath or fatigue or pain in other parts of your body like your jaw, your abdomen. So when in doubt, this is my message, when in doubt, call 911. That could be a lifesaver. The reason for having a heart attack and a stroke are very similar. It's clogging of your arteries. In the case of the heart attack, it's a clogging of the arteries going to your heart. In the case of a stroke, it's clogging of the arteries going to your brain. So the reason is the same, but they manifest differently. So we focused on heart attack earlier, but I can tell you the symptoms of a stroke. We use the mnemonic FAST, F-A-S-T. So, is there any facial drooping? So if you're concerned, ask the person to smile at you and you can see a facial drooping. Or weakness of your arms, so have the person hold up your arms or yourself. And slurred speech is extremely important. Person cannot get the words out or slurring on the speech. And the T stands for time to act. Time is of most importance. Time is of essence. Call 911. So these are the symptoms you look out for a stroke. It's now known that 2/3 of people who have strokes in the US have had mini strokes that they didn't realize they had. So if you have any doubt whether you're at risk for stroke, talk to your primary care doctor or talk to your cardiologist. There is a lot you can do. As I mentioned earlier, heart disease and strokes are almost 100% preventable. So what can we do? Chief among them is trying to quit smoking or getting help to quit smoking from your primary care physician, and controlling your diabetes, controlling your blood pressure. By good blood pressure, I mean a blood pressure below 130/80 at all times. Exercise is very important. Getting 30 minutes of aerobic exercise at least 5 days a week. And it doesn't have to be all together. You can do 10-minute stretches or do however much you can do. And eating a good diet. By that I mean a diet low in salt, which is processed foods, high in fiber, and more vegetables, fruits, and oily fish. Losing even 5 to 10 pounds will make a big impact to your life expectancy and the risk of getting heart attacks and strokes. Yes, these days we are all terrified of getting COVID. We have seen the mortality rates and the people going into the hospitals. But what I can tell you is that our knowledge of COVID evolves day by day. What we know as of now are the high-risk patients are patients that have cancer, that are on chemotherapy, so the immune systems are weak, or patients who have chronic kidney disease or chronic lung disease like emphysema, or patients who are diabetics, and most importantly, patients who are in the obesity category. So if you have a body mass index above 30, we have now known that you are higher risk. So just having well-controlled hypertension, doesn't necessarily place you at very high risk. So if you have any risk factors, particularly if you think you have a high family history of heart attacks and strokes, that's a good time to see a cardiologist. And if you have any of the risk factors that I mentioned, the diabetes, the high blood pressure, smoking, overweight, obese, or lack of exercise, then talk to your primary care physicians. They will be able to guide you on the timing to see a cardiologist, or you can see a cardiologist, make an appointment by yourself. A good thing to do is to go on the Adventist HealthCare site and take the risk calculator if you're unsure what your risk is. And that will predict your risk of a heart attack and strokes, and then you can make an appointment with a cardiologist.